Hey, it's a nursing professor here. I want to give you some helpful tips on taking notes. Because what I find is students take notes on everything, and then it gets to be really too much. All right. So first of all, you want to handwrite your notes to make certain that you get that muscle memory of you actually putting the words on your paper. When you do that, there's been research to support that you tend to remember what you write. So give it a try. Even if you're using an electronic device like an iPad, still the same mechanism that you're using a stylet, and you're able to write into your notes area. So that's also a good thing to do. Other tech tools might be using your phone and using speech to text, and then that way you're able to go back and hear it or reread your notes in that way. If you are a student that is English as your second language, please write down the words that you don't understand. Just put them in a side column and make sure that you're getting the meaning of those words before you actually go through all of your notes, because it's going to make the notes make more sense. We know English is not an easily translatable language, especially when it comes to medical terminology. But if you don't understand key words, you're never going to understand the question, and you're going to always struggle. So make that a habit. Anything you don't understand, write it in the column, and that way you're able to easily identify that. Go look it up, find a definition, and then come back to your notes. Use of audiobooks. You know, all books now, they come with that audio function. You use Vital Source, go in, you can listen to it at any time. If you have a long commute, if you're a person who exercises, if you're a person who's just doing your housework, you could put your headphones on, you could actually listen to your book, and that way you're absorbing some of the information as well. If you're using a notepad, make sure you're putting a title at the top of your notes. So for an example, if I was writing notes on this pad, I would put the title. So if I'm studying renal function, or if I'm studying diabetes, I have it right here. And the reason is that it helps with easy identification as to what the topic is of those particular notes. Write every other line, because that gives you space in order to fill in or highlight or something else you might want to put in there. But if you write close together, it's going to be very difficult to go back in and make any type of corrections. When you take your notes, make sure you're reading them the same day, so that the next time you have class, you can ask questions. You can ask your instructor to fill in blanks where you might have missed something, or something that you need further clarification. It's helpful to you, because at least you're having a conversation that shows that you actually did something. You did some work, and this is the blank that needs to be filled in. And usually you'll get really good feedback from your instructor when it comes to that. Make sure that you're reviewing, you're reading your notes, but you're also reviewing, summarizing, and clarifying anything that you don't understand. Now, when you study now for Next Gen Ed, make sure at the end of that particular topic, so say again you're on renal failure, that you find a case study with a patient that has renal failure, and then it's going to give you a series of questions. The reason that is helpful is that is what Next Gen Ed questions are. And so it forces you to prioritize, to look at what's important, to determine what you should do first. It forces you to think in that way, and therefore you're going to have better success when you actually take your NCLEX. So those are just some helpful tips that I have for you when you're writing your notes and when you're studying. Bye for now.